Hello, this is Dr. Gay from First Look MRI, and this is a 52-year-old female who complains of left shoulder pain, no injury, and she has two findings. One of them is pretty obvious on this view. This is a short axis view called a sagittal image. We see the humeral head here, humeral shaft. We see the patient's rotator cuff, which is this dark band, this broad tendon that wraps around the humeral head. We see the biceps tendon, which comes up here, goes through here, through the rotator interval, attaches. And the main finding is up here above the shoulder. So this area up here looks very bright. This is prominent edema within the acromion and clavicle. And the AC joint is right here. Normally we see a nice, well-defined dark line and a little space, but the space is obliterated and it's irregular. There's also a little thing that looks like a bird's beak poking down here. This is an osteophytic spur projecting from the inferior margin of the distal clavicle at that AC joint. Now in this view, we're looking straight at the patient. We can see their humeral head, neck, and shaft. And here we see the acromion. Here's that inflamed, irritated AC joint, or degenerated AC joint, and this is the clavicle. So they come together, and here it is. So this is the main problem. Lots of edema and inflammation. On this view, marrow is low signal if it's abnormal, so this is low and abnormal. Now we're going to put up a view where it just switches, where its abnormal marrow is bright, and here it really jumps out, this severe arthritis, erosive change in marrow edema. Now we note also that this bony spur pushes down on this, which is the supraspinatus muscle, part of the rotator cuff. And even though it's pushing on the muscle, there's no muscle irritation, there's no tendinopathy or tear. When the spurs push down, we call that impingement, if they have pain or if it irritates the muscle underneath, or can even lead to a tear of the muscle. So this is severe AC arthropathy. Now their other finding is down here, this little blip of brightness along the inferior glenoid, so the bottom of the joint. If we look on this view here, we see an abnormal little bit of fluid, and it goes all the way over here to the inferior glenoid, a little round ball there. So this is a labral tear, an inferior labral tear. You zoom it on up, the tear goes right through the base of the labrum, and fluid is leaking out, and the fluid goes medial, and it communicates with the tiny paralabral cyst. So an inferior labral tear and paralabral cyst. So two findings in this patient. Thank you very much.